what? Hyperlipidemia is a condition in which your blood has too many triglycerides and or fat. It is also known as high cholesterol. Cholesterol is essential in order for our body to make cells, hormones, and vitamins, but in excess, it can be a problem. There are two types of cholesterol. Low-density lipoprotein is also known as LDL, and this is bad. It can lead to heart disease and stroke. Then there's high-density lipoprotein, or HDL. This is the good type of cholesterol. It helps prevent heart disease and stroke. Here in the picture, or in animation, you can see our blood vessels. You see a man dumping LDL, which can lead to heart disease and stroke. And then you see HDL, and the man is picking up the LDL and removing it, which helps prevent heart disease and stroke.
About 2 in 5 adults in the United States have a cholesterol level over 200 milligrams per deciliter, qualifying them for hyperlipidemia. Having type 2 diabetes or obesity also puts you at higher risk. Getting older increases your risk as well, so if you don't find the fountain of youth, become aware of your cholesterol levels.
What causes hyperlipidemia? Some might argue it's the best things in life. There are two different causes of hyperlipidemia. There are the things that you cannot control, like your family genes you inherit, and there are the things that you can control. This, as you can see in the list, is the biggest factor or cause of hyperlipidemia, aka the fat in your blood. Everyone wants to live their best life, but we have to do it in moderation. Your lifestyle is key here. Smoking, including secondhand, drinking a lot of alcohol, like partying, eating bad foods often, your fast food diet, chips, fried chicken, sausage, bacon, butter. Sounds like a list of the best foods, right? You can still have it, but in moderation. Being lazy is another factor, not being active or just straight up being a couch potato. There's stress, although sometimes we can't help it. And lastly, if you're doing everything on the list of factors you can control, chances are you are overweight or even obese, and your lifestyle needs some serious changes.
How can you tell if you have hyperlipidemia? Hyperlipidemia, or high cholesterol, has no symptoms. It is not something that you can feel. A blood test is the only way to find out if you have high cholesterol, so see your doctor to have your lipid levels checked.
Now you may be wondering, if I have high cholesterol, what will treatment look like? You can choose foods low in fat, for example, low-fat milk. You can increase your fiber intake, such as fruits and veggies. You can lose weight, and you'll do that by changing your diet. You can also quit smoking, limit your alcohol consumption, exercise a few days a week for at least 30 minutes. This not only helps you lose weight, but it also helps your heart. And if diet and lifestyle changes are not enough to help lower your cholesterol, then medication may be needed, and this will be prescribed by your doctor.
And a little bit about what we need to know if someone has hyperlipidemia. If you're someone living with hyperlipidemia, getting exercise and quitting smoking are two things that can help you. And like what has been mentioned throughout this video, limiting your amount of fatty foods, limiting alcohol, or just quitting drinking together is another option for limiting your cholesterol levels, as well as making healthier choices, including more fruits and vegetables. And finally, since there are no signs and symptoms, it is important to continue to see your primary care physician and have your cholesterol levels checked regularly, and have a plan with your doctor to treat these symptoms. And here we have some community resources that people in the San Joaquin Valley are able to access if they have hyperlipidemia. First, we have the Health Plan of San Joaquin, just getting in with a primary care physician and getting those tests done. And finally, we have HT family physicians, who are some high cholesterol specialists that can help people manage their hyperlipidemia and live healthier lives. Let's apply some of what we learned and look at some of the choices someone may make. Now, when looking at this person, they are clearly not making good choices for someone who may be struggling with hyperlipidemia. These foods are full of fats and can end up worsening the situation of someone with hyperlipidemia. Let's now look at someone who is making some better choices for someone with hyperlipidemia. Here we see someone making better food choices for living with hyperlipidemia. Eating more fruits and being active is a key part of managing hyperlipidemia.